Good evening, everybody. This first talk is to give you a little bit of context of the potential of the application of technologies in the healthcare setting. I'm a neurologist, and I'm going to give you an overview of some needs in which these technologies can change for better the care of the patients. First of all, I want to stress the importance of electronic health records in neurology. The semiology is the core of the diagnostic process. This is what the patient tells you, the symptoms, and what do you see when you examine the patient, the signs. And this is all in the clinical records. And is in its vast majority in form of free text, because in the digitalization evolution of the healthcare, it has been demonstrated that free text documentation is more sustainable than structured fields or structured forms that in clinical practice are more time-consuming and less flexible. The reuse of electronic health records for clinical research can reveal the unknown. And for example, in autoimmune encephalitis, encephalitis is inflammation of the brain, and it was thought to be infectious, but 13 years ago it was discovered that some patients didn't have an infection, but had an autoimmune disorder. The immune system was confused and attacked the brain, triggered by a hidden tumor. In many cases were ovarian teratoma. So in a scenario like this, you've got a novel disease. You want to know in which patients with an ovarian teratoma will develop neurological symptoms. You will need years of a prospective study to gather this kind of information. But if you're able to interrogate your electronic health records, you can, in a fast way, have a very quick view of this problem. Not only that, but also the richness of the electronic health record. It's very difficult to get it with structured data, like, for example, a normalized nomenclature for classification of diseases like the ICD-10. If you get the code for encephalitis, you will have this description. This is the highest piece of information that you can have, and you cannot interrogate, for example, if autoimmune is as common or more common than infectious, because you don't have that information in the structured data. But not only a rich information, but also electronic health records contain real-world data, and this is very important to overcome the bias that can be derived from publications, the publications bias, and the highly selected patients that are enrolled in clinical trials. And not only to reveal the unknown, but they can serve as a clinical decision support systems in front of diagnostic problems. And this is an example. Patients presented with psychosis for the first time, many of them will develop a chronic psychiatric illness like schizophrenia, but a small proportion of them will have a treatable condition. The psychosis would be secondary to a brain or medical disorder. And to diagnose those patients, you need to do a battery of tests that you normally don't have, or you don't do routinely in psychotic patients, because it's not cost effective. So if you're able to extract the information from the clinical onset and use it with machine learning to give you a risk of a treatable condition in front of a particular patient, you can optimize your resources and diagnose, or don't miss to diagnose patients with treatable conditions. Another clinical scenario is when you have the diagnosis, for example, in multiple sclerosis. This is a disease that affects, it's a disease of the brain that affects young people, and with time, if you don't treat it, it can produce a high disability. You can have patients in a wheelchair at 40 years old if you don't treat them. So we've learned that we have to treat these disease early, and fortunately in the last decade a lot of different new treatment options appeared, but the thing is that the highest efficacy goes by hand of a highest rate of secondary effects of the drug. And the thing is that we are not able nowadays to predict how aggressive the disease is going to be, to decide how aggressive the treatment should be in an early stage. So if we could compare the clinical trajectory, the clinical records of patients that have a more aggressive clinical course, and to see how similar is this in front of a particular patient in which we have to make this decision, that would help us to choose a more aggressive therapy early in the disease instead of another kind of therapy. And the third block is to monitor the brain function, and this is specific for neurology. Speech is one of the most important high functions of the brain, and if we can analyze the speech, we can, for example, monitor the loss of function that occurs in neurodegenerative diseases like Alzheimer's or Parkinson's disease. We can analyze or monitor the recovery in cases, for example, in strokes that affect areas implicated in the language, to monitor the impact of the rehabilitation process. But not only we are able to analyze the structure, it's also useful to be able to analyze the content of the speech as a measure of thought, and to see if we can predict, analyzing changes in the content, if we can predict, for example, a transition to psychosis or to similar conditions like delirium, for example. This is a paper showing that the speech analysis in a neurodegenerative disease like Parkinson's disease, it was useful to quantify the symptom severity, and it was as useful as the standard clinical scale to measure this severity, which is a unified Parkinson's disease rating scale, but with a lot of advantages, such as self-administered. The patient can do it at home, and it can be analyzed in the clinic, in the hospital or in the academic institution, and to do an automatic action. So it's, you don't need to have the patient in front of you, and you don't need to do this standard scale that is very tedious, and it has an inter-rater variability. And finally, analyzing the language in a real-world setting could predict certain diseases like depression before even that the patient seeks for medical advice. And to finish, I want to give a couple of thoughts about challenges that I find as a clinician of applying these kind of technologies in healthcare. First of them is the different languages that you can find in the electronic health records. If you go to a hospital, any hospital in Barcelona, you will find a bilingual system, and also the specific lexicon or abbreviations from certain clinical domains. On your right-hand side, you have an extract from an ophthalmologist clinical note. I don't know if you can understand anything, but I barely do. This is what happens in a clinical practice. They've got their own language, and it's very difficult to understand it if you're not an ophthalmologist. So I guess that a machine that has not been trained in that kind of lexicon will have also problems to retrieve information from there. To get the most of these technologies, I think that we have to deal with interoperability to be able to merge or to analyze the electronic health records from patients from different hospitals, and this is very important for low prevalent diseases or events. And to get the most of it, also to be able to integrate this text mining with other information sources like neurological brain biobank or blood biobank. For prediction tasks, it's important to understand the data. And I've seen a paper stating or showing a very accurate classifier to classify a certain complication, medical complication, and when you see the most important features weighting in the decision of that classifier was the drug that is given to treat that kind of complication. So it's not useful to have a predictor that classify something that you have already classified as a clinician. In the case of clinical support decision system, ideally it's something that has to be done in real time, to be able to analyze the data in real time. And the model accuracy that should be objective, or the objective, shouldn't be always 100%. You've got to evaluate the different use case. But if the uncertainty in the clinical practice is very high, it's good enough if it's not the 100%, but the accuracy of the model is over the physician performance. And another essential point is the external validation. Once that an algorithm or a classifier has been developed, it's very important to evaluate how it generalizes to other clinical settings and have these external validation. And this kind of work of papers is not very appealing, this kind of reproducibility work, but it's essential to translate any kind of algorithm to the clinical real practice, as well as model explainability. I don't think that in the first instance you need to understand exactly which factors are taken into account to have a certain decision in the machine learning and a deep learning process, for example. But in the long term, it's important to understand if it has biological plausibility, or if you can modify that kind of factors before you understand which kind of factors weight in the decision. And with that, I thank you all for your attention and hope that you enjoy the hackathon. Good night.